fun as the in-person. I miss seeing y'all, miss seeing everybody, and I'm betting everybody's kind of missing the free lunch. But otherwise, this has been pretty good the past 2 months. So let's see. Everything. We are now recording. So if anybody doesn't want to be recorded, well, just don't say anything. Chapter leadership. Once again, me. I'm Kyle Smith. I'm the chapter leader. Kate Brew is our speaker. We have the whole list of people here. Matt Pardo, education. Tiana Chandler is a sponsor. Ryan's our PR marketing. Griff is our great membership coordinator. And we have a nice, good advisory board of past chapter leaders that have helped out with lots of different things here. Wrong machine. If you signed into Eventbrite, we'll get you some CP. You can get some CPs if you email austin@owasp.org. We'll get you a sheet out to you. Someday I'll get that to you. Also, AJ, I think you're about the only one who requested, but I'll get those out to y'all. OWASP, there's a bunch of ways you can support it. You can join the leadership team. We're all volunteers. We get paid such huge big bucks to be volunteers and use our time here. It's great stuff, but it's good to get in front of people and talk. And there's also speaking opportunities, like what Hazel is going to do in a little bit. You can, if you have a presentation that you like to give, even like the one you like to try out. It can be technical, it can be administrative, it can be organizational, it can be just a general discussion on anything OWASP related, which is usually application security. That covers the gamut of things, so it can be anything. Amazon, there's also that smile.amazon.com. And by the way, OWASP Foundation is a 501c3 organization, so it's tax deductible, and many organizations will match it. There's memberships. Y'all have gone through this before. $50 is usually your typical year. There's a lifetime for $500. There's also a lot of corporate memberships. So if you have an organization that wants to be known with OWASP, their corporation, the foundation is taking a lot of companies now and having corporation memberships. And you'll see there's a banner at the bottom of a lot of the OWASP pages where we're promoting a lot of the groups that have joined us. It's great stuff. If you have other questions regarding these things, including student memberships, please talk to Griff. His email address is right there on the screen. And we have how to keep in contact with us. We have a mailing list. It's in Google Groups. There's a link to join it at austin.owasp.org, and you'll have to do the whole CAPTCHA thing. It's really a quiet list, so don't worry about too much. It really gets announcements about these meetings. Someday our happy hour, LastCon potentially, things like that, and anything else that we might see for the Dallas or Houston area also. Even San Antonio, which is also one of the big OWASP groups. And we have a whole bunch of Slack channels, I guess. OWASP Austin at Slack is there, which you can join using this link. If you want to take a screenshot of that, that'd be a great way. Your OWASP itself, if you have an OWASP.org email address, being a member, you can join the OWASP at Slack group using that Heroku app link. There's actually a LastCon link too, which we really promote during the conference and prior to the conference, but we'll get that out there eventually. And by the way, new thing this month is we are now on Meetup. Hopefully some of y'all joined us through Meetup. I think we had about 15 people sign up via Meetup for this thing. OWASP Foundation is heavy into Meetup. There is a whole bunch of the chapters are listed there. I think almost 100 of them are on there now. So now OWASP Austin is. It looks like we're newbies to these things. We've actually been around for 10 years. So if anybody's joined us from there, we are now live there too. And did you know we have a LinkedIn group? Probably not, most people don't. We actually do have a LinkedIn group that's been around for a few years, and you can join it using that link there, or you just look for the OWASP Austin chapter. It's moderated. It hasn't, I think much of the salesmen who used to post things to it have moved on, so it's relatively quiet, which is nice. It's these type of announcements and potentially other things too, but there's a fair number of people there. We are also on both YouTube and Vimeo. There's an OWASP Austin channel on both of them. There's archives in Vimeo till let's see, August 2018, and some of the later ones we have links. And if you go into austin.owasp.org and look at our event archives, you'll see those Zoom links. Some of those are still there, some are not, but we have a lot of the ability for watching previous videos. Study group, it is obviously virtual only in this new age that we're in. There inside the OWASP Austin Slack channel is a study group channel. I don't know, sub channel, I don't know what it's called anymore. But if you have any questions regarding the study group, especially what they're doing, I don't see Matt on here, but he may be, but he is the education coordinator, and he is available at matt.pardo@owasp.org. He's also set up a lot of other fun things, like we had last month, we had a capture the flag put on by one of the vendors by Security Innovations, which was great fun. LastCon, we are still hoping to host this. Our tickets are available. Early bird tickets, we've extended that till, I believe, the end of June. So I'm not sure, it might be the end of May. I mean, to look at that this week. But the CFP, the call for papers, is open. So if you have anything that you'd like to present at a security conference, we are available for doing that. A call for papers is open at, if you go to lastcon.org, you'll find the link over to Submittable, and you'll get submitted into us. By the way, if you use Submittable, it's a really nice service now that OWASP in general is using, that you can submit. Submittable does a great presentation of presenting all the different conferences you can potentially present at if you'd like OWASP Foundation's AppSec or Global Application Security Conference. I don't know, it's not the AppSec USA anymore, but it was over in San Francisco the week before LastCon, and it was there too. You could have submitted to both of them too. And also the call for training is available too, available over at Submittable. Good stuff. LastCon, save the dates on end of October this year. Unfortunately, we're have to canceling the happy hour again this month. While a lot of the restrictions have been lifted, there's still too many for us to comfortably do it, and the environment is still too uncomfortable to have that much of a social gathering. Hopefully we'll get this back soon enough. Other upcoming events that I know of that's on the ISSA calendar, if you see there's a link up at the top of the page there that is the austinissa.org. They usually keep up a fairly good calendar at what's going on around here. But for local organizations like the AHA, ISC Squared, Cloud, I don't think Cloud Austin's on there, so that's one I attend a lot. ISSA, ACP, things like this. It's some fairly good ones. Everyone's doing virtual right now. Unfortunately, DevOps Days 2020 was canceled back in May. I got to take that off. And HUSECCon, whoops, should be HUSECCon. It's actually been postponed, I believe, to. Oh, I can't actually guess when. I can't remember what it was. B-Sides was 2 months ago, but it's been postponed till December. It has been rescheduled. So we're still looking forward to that one. Matt Pardo, our education coordinator for OWASP here in Austin, that does a great job of putting that on. Speaking opportunities, like I said earlier, if you want to get involved with LastCon, we have speaking opportunities, these monthly chapter meetings, LastCon itself. Kate Brew is the great speaker coordinator that we have here, and it's Kate M. Brew at owasp.org. I got to put her email address on there, but she is the one who is coordinating everything. And last but not least, definitely not least, is Hazel. Hazel Chappell, she has arrived, she arrived in Austin over 2 years ago from UK working in healthcare. She's done all types of, she's a highly organized leader, consultant, advisor, and EPR deployments in both private and government organizations. Hazel special, I can read you what the speaker information was. She's a great person to talk about the changes and the organizational abilities that you need. And she'll be talking about why organizational change management is important in cybersecurity for healthcare. And there we go. Get you at least 50 minutes here, Hazel, and see if I can stop sharing and pass the buck to you.
Okay.
You should be able to present your screen now, I think.
Just working on it.
No problems.
So can you see that, Carl?
Looks good.
Yeah. So I guess this is a first experience for me doing a virtual presentation, because normally I'm quite an interactive person with my attendees. So I'm just thinking on that note, actually, would it be better that I start a video if people want to see me?
That works pretty well.
Yeah.
Anybody else wants to start the video, it's up to them, but yeah, that was good seeing you there, Hazel.
Okay, so hi everybody. So I'll just kick off. I'm actually going to just do it as kind of an informal approach, because from my experience this works well, and from my the work that I do, as I progress in the presentation, it's more effective rather than a very corporate pitch. So I guess I'll kick off. 50 minutes. Interesting to see if I can talk for that long, but we'll go with it. How, Carl, do you normally like to play it? Question and answers at the end, perhaps?
At the end is fine. I mean, you don't have to go the full time. It's up to you however long your presentation and what you want to talk about is. I was just...
Okay. So, right. Sorry, excuse me. So this is just a brief look at what's coming down the line for the next whatever period of time. And I've amended some of those, of course, thanks to COVID-19. So this just gives a brief outline of who I am, I suppose, in a little bit more at a very high level. Some people will recognize some logos. And I guess really because the one thing that we all have in common on this call is that at some time or other, we are all patients in some capacity, in some shape, through childhood or in adults. So whilst this is what I would, and please Carl, correct me at any time, but whilst I would regard this as a very experienced technical audience, I am not, but I have extensive experience in healthcare. So I'm approaching this from a business aspect, but very much as well what we all have in common here. So in my experience of the last 17 years in healthcare, I've worked a lot in child health. As my bio says, I'm just under 2 years here in Austin now, having come from the UK. However, I'm Irish born and bred. I've worked in primary care, out in the community, acute and hospital care settings. Great Ormond Street would be the equivalent of Texas Children's Hospital here, and the NHS is the public health service in the UK, which is a very interesting organisation in comparison to what the US healthcare looks like. You'll see as well that eHealth Ireland, I remain with a very strong stake in the ground there as well, and I remain on a government committee which is implementing a national strategy for healthcare. So I also as well have done some change management work within the overarching body, worked abroad as well, and a more corporate aspect, as well as being very much a partner and advisor with some leading organizations. My previous world was in financials down in London. And of course, then I'm a member of other fun organizations, which if we get time to talk about, I'm sure that, women in cybersecurity. But here in Austin, since I've arrived, I set up a company called Uisce Health. Uisce is the actual Irish word, not in that spelling, for water. And I guess we all know, particularly in Texas, we all need water as one of the basic human elements as a need. Thus Uisce Health. I'm very much connected with the Irish Consul General here and the Irish community within Austin and across the US. I have supported from an innovation and entrepreneurial aspect UK trade and investment, and I remain closely linked with them. I'm a business advisor at the Dell Med Catalyst program here in town. And to my experience within cybersecurity and what that's about, I recently did some work with Health 2047, which is in my bio, as and it is important to recognize as the innovation and investment arm of the American Medical Association. So I'm very aware here in Austin, we have the Austin Health Association, we have the American or else Texas Nurses Association, but also as well change management and what that is and part of what that is about as well. So that's a very high level just to areas that I'm involved in. Sorry, and there arrived palliative care end of life. So, so why is change management essential? So I see it at a very simplistic level that the pieces of the jigsaw refer to an organization's various sections, departments, entities, as I say. So when implementing new change, it's a case of who is actually communicating, working with all the various organizations, all the different people within that organization. So if you can imagine a hospital, you have the admin, you have clinical, you have financial, you have leadership, and very much then you have the online, the frontline staff on the ground as well. So it's essential to have somebody at the hub of all of that who is actually, I suppose, helicoptering it from a high level, but also understanding it from the ground level up as well. So defining change management up until, I guess, February, what we call pre-COVID, change management was a very specific methodology which included different tools and understanding, and there are various models out there of what it looks like. I do have some notes on my side as well, so I will be looking at those as a reference. And there are also as well different theories about how and what is change management. I guess on a simplistic level, having spoken to people, and I have attended, I think it's 2 of the OWASP meetings there in town, thanks to Larry Moore, that some people didn't actually know what change management was, and other people were smiling and actually had not a good experience of being in transformational change. So that's the reason why I did actually describe it with the past of, a past definition was the management of people to achieve the identified outcomes. And as I say, that's at a very high level. But in terms of, if you look at the center picture here and what it is, if you look at each one of those, it's a much more comprehensive approach, factoring in many, many entities. And the one thing that certainly seems to be standing out, that where previously there was resistance to change or whatever, the people are at the core of all of this. So that is why then that, like anything with change, the wording and the definition has now come to humanizing change. So it's actually, is it really about the people? Is it really about actually managing the people? And there is a very key theme in the presentation today on how the people, the human side and the behaviors play an intrinsic role in achieving successful change. So I will also add as well that where I mentioned about many different models, people have often asked me, and as I say within healthcare, what model do you use? Do you use Kotter? Do you use Kubler? Do you use ADKAR? And while all of those are very specific and totally non-relevant to people listening here today, the one actually that seems to spring out more in mind is actually the nudge theory. And I will talk about that a little bit again. Funny enough, it's actually to do with the behavioral aspect as well. So I thought it was important as well just to give a background of how healthcare has changed so that we understand how we arrived at where we are today. In terms of, and for those of us who are older than others, but the past was limited technology, as you can actually see as well. It was a much more manual-based approach. It is fair to say that it does exist still in certain areas. I'm sure it does in certain parts of Texas. Certainly coming from Ireland, the more you go down the country, it's still very much non-technical and in some instances very much manual-based, paper-based, paper records as well. And when I say siloed care, different organized, subject to what healthcare conditions that one has, or whether it's what we call more chronic morbidities, then actually who is talking to each other? How does, if I need to be referred, how do they know exactly what current situations or what conditions I have or how my current health is? Do they know that I've been to the dentist and I've had to actually get very specific medication for that abscess? And subject now to what's been prescribed for me, how and will that impact my health moving forward? Then we've moved on, I suppose, to what's being perceived more as what we're about now, the actual online booking. So taking here in the US, we have, I suppose really, if I can take it that within the cybersecurity world, there's very much, I have learned very much a specific language and terminology, and it's the same in healthcare as well. A wonderful challenge for me is how do I dovetail the two, and how long will it take me to actually understand where and how to speak cybersecurity, bringing the change management element into it, because now I've nearly got 3 languages I have to be able to communicate with, translate for the different people in the room, virtual or otherwise, which was a wonderful challenge. And of course, then we have telehealth. I'll talk about that actually a little bit more in a moment. Data, data, data. That's what it's all about. Here in Austin as well, health, innovation, data, what is going on, what the future, as we can see here. Electronic prescribing. It's wonderful to see you go to a doctor, you need a prescription, you name your chemist. Are you over in HEB? Is it available within the next half an hour? And then we have something that's remote monitoring. So people are being discharged from hospital. They need to keep their blood pressure after heart problems or whatever, or certainly with COVID-19 patients as well, that it will be and is an intrinsic part of care within the current times. So I put this arrow here at the bottom because when we move forward all across here, we still need the people, we need the processes, and we certainly need the technology. Now, as somebody once said, irrespective of the technology, whether it's good technology or bad technology, if the people aren't right, it's not going to work. And the people create the process. So that's a point to remember for just further down the line. Now, I've actually just, forgive me, I'm moving my, I suppose the video part away. It's taken up my screen. So what does the future look like in healthcare? Well, people have already, and are subject to the digital maturity of healthcare. In the UK, it could be argued they're further ahead in the game. And yet I can confidently say with regard to trace and tracking for COVID-19, fantastic challenges on that. And as of recently on the BBC News, it's been identified that there are huge challenges with the track and trace pilot that's going on in a small island called the Isle of Wight. Interestingly, with a great opportunity for new vulnerabilities. But that is the way that it's going to be. We're going to be looking at the app access, not just to book appointments, but to actually get blood results back from the lab. Is it more as well about while we have telehealth in place now, is that going to be the way forward? Is it only going to be the way forward? But yet we have to question the human interaction. What I mean by virtual health here is it's about the continuous monitoring outside of a healthcare environment, i.e. in your home. There certainly is a greater need, there's a greater drive to self-empower patients to be more resilient, to be more mindful of their own health and how with chronic conditions, with the diabetes, with the chronic kidney disease, how is that actually going to be monitored virtually? I had the wonderful experience of in working, not Texas Children's Urgent Care, but another hospital, of actually understanding a baby that was born and having gone through significant heart operations, you know, in NICU, neonatal intensive care unit. The clinicians were able to monitor the baby's health, interacting with telehealth consultation. So rather than the mom actually coming something like 360 miles, it was actually being able, the virtual health aspect. So it is in place, but this is the way that it's going to be. I note as well, open integrated technology. So I am a fan of open source technology. There was a point in my career about 4 years ago that I could have gone very much down that way and route, and certainly in some countries it is being very welcomed. Estonia and Finland actually do health information exchange. Estonia is the first digital country in the world, and they are a fantastic supporter of that. Then we have innovation. Innovation go hand in hand with healthcare, and particularly in Austin, where it is on steroids from an innovation point of view. I very much continue to see it to be that way, and I am confident being involved in circles about how and where that is going. But it certainly, it has a place, and how that will actually, as I say, play a greater role, which can't be avoided. Artificial intelligence, I spoke earlier about data. Data and artificial intelligence go hand in hand. How and what can be automated? Or are we talking about AI that's going to be augmented intelligence, where key roles and how and what we'll do plays a part? I'm very much connected with Dell Technologies and the work that they're doing there, and more national bodies across the country. This is it's unavoidable. This is, I suppose, really the baby of the future starting now. Arguably, people think that it's more advanced than it is. It is not at the moment. And it is actually going to play a role as well with precision medicine, or precision medicine. So I can talk a little bit about that, about a great piece of work that's happening in Dublin actually on epilepsy. Connected health and wellness. So this is something that's really important to all. Integration. It's happening. It's integration is going to increase speed and agility for today and the futures, so that companies and healthcare systems can be more resilient, and they're being able to connect from one system while being able to improve the patient experience. I'm confident that so many people can be frustrated already by not knowing, having to go from A to B and being referred to A to B, what the challenges are there. So why is there greater awareness for cybersecurity? So I was looking up clearly some research in advance of today, but in addition to the work that I actually did with Health 2047, which was due diligence on where cybersecurity has a space within healthcare. And it appears that the 2013 presidential directive declared that healthcare is now part of the critical infrastructure. One could argue that beforehand, well, was healthcare not always at the forefront? And ironically, COVID-19 comes along, hey-ho, it really is one of, as I say, if not the top target actually at the moment. But in the meantime, pre-COVID-19, it was a known fact that a patient's record can be bought and sold on the dark web. For those of you who know a lot more about this, but I had the pleasure of actually going in and seeing on the dark web of what goes on, and the cost that comes with it. So it's not just a physical cost, it's a cost to the patient, it's a cost to the organization as well. Data breaches. So they can actually be intentional or unintentional, as we know. They can be, so intentional, clearly unintentional. I had the experience of where in the paper-based transitioning to digital, a GP's laptop was actually taken from his car. And he decided on a post-it to have his password there. So that actually caused consternation, certainly back in the day. Now, when I joined healthcare as part of the initial digital transformation over 17 years ago, it was actually the second biggest project in the UK after the Indian Railways. So I have actually been in a position to see the journey across from the very beginning to where we are now, and the data breaches and the costs that come with it. Also very much the human side as well, how that actually plays a role in the data breaches. Is it a case that somebody walks away from their computer and then somebody else comes in and see what's happening? And that is a very common cause. Working from home in these times has brought greater challenges as well. And certainly it has actually been the catalyst for organizations, certainly within healthcare as well, in terms of how to actually adapt quickly. COVID-19 heat maps, when it all came out, we were all curious to see and understand what exactly is going on, who are being threatened in the biggest places. They have been deemed to be the biggest threat to any user in healthcare and cybersecurity or not, and the phishing that has gone on with that. Perhaps I'm telling you the obvious, but unfortunately we don't know what the impact is on that yet. And that has been something that is causing great concern on a national level, and certainly with CISA and greater. Ransomware, insurance companies are having fun and games, and certainly more the legal work has gone up on this, as you know, as well, because health organizations are now insured against this, but where the lurkers hang in, then of course, when they are actually being threatened, the insurance is being paid, so it becomes a vicious cycle, but is not actually dealing with understanding how to mitigate these moving forward, how to resolve them. So within healthcare as well, the fact that there is a greater need to share data with COVID-19 has caused really a significant awareness for cybersecurity and bring it more to the forefront here. In terms of health information exchange, I'm involved in some of the work that's going on within Texas. I've actually seen some of the work as well at a national level with the national coordinator, which comes under the Department of the Deputy Secretary on a legal level. So the need to share data where there is no seamless transition creates greater vulnerabilities. So where does change play a role in cybersecurity? So in no particular order, we have leadership. We're back to the people aspect again. So leadership is where we look to people to foster greater relationship who actively engage. Ironically, from a link which I can send out if necessary today, leadership who do not fulfill their role, unfortunately, actually can cause greater or disable greater traction for cybersecurity and how it's administered. And I know, having spoken to some of you already, actually, the conversations and the communications around that can be fantastically challenging. So it is also as well where change supports the leadership as well in helping them to understand better, in helping them to harness the necessary components is fundamental. And also a change leader will actually help as well to re-strategize or help communicate. My experience as well with stakeholder management, I have spoken to many disengaged people, many frustrated people in organizations, where they've actually identified are the right people in the right places to lead this change. And a lot of the times that is not the case. It is actually where people feel that they own a position is less, causes greater problems there. We look as well at responsibility. And what does a governance model like? I have set up many governance models within organizations who will actually help culminate responsibility from the various sectors. I spoke earlier about the finance, the corporate, the clinicians. Clinicians are quite opinionated in their own way, so therefore their understanding of why should they be responsible for cybersecurity can be very interesting conversation indeed. Very interesting as well that I was actually, I had visibility to a conversation about looking at current leadership styles, and I'll give the comparison of actually Hitler and Eisenhower. So where one was very siloed mindsets and the actions were very abstract and not communicated well, whereas the other was very open and inclusive, communicating regularly. I'll leave it up to you to actually decide which style was suitable to which leader. Oh, excuse me. Risk management. This is a conversation today as to how change and the management of change is actually transpiring or morphing into a new role. So where risk management actually looks at clearly the risks and how they're being mitigated or whether they're important. The quantitative risk measurement techniques that are now in place are very interesting, and it helps evaluate not just from a financial point of view, but also as well, having attended a meeting here in Austin and where the National Sector Chief for the CISA, when I asked him what was his biggest problem with cybersecurity, he was confident that it was actually that risk management was being done at a siloed level and not involved with the leaders or with the people on the ground in cybersecurity. And that can be applicable to any industry, but certainly it is a huge area that the change leader plays a role in, yet again, helicoptering and harnessing these together. Business continuity, that's on everybody's top priority at the moment, especially in COVID times. And it's actually understanding about how are the hospitals going to actually sustain where their elective surgeries, maybe some of you have already been involved in elective surgeries, but how is actually that going to re-engage itself and energize it? Who is actually as well going to look at the business analysis side? Who's going to manage the business contingency plans as well? And who's actually then going to work on who's going to project manage them, the business, and that's actually cumulatively called the triple threat approach to change. Education, excuse me, sorry. Education, again, we all know that knowledge is imperative to move forward. With the change that's taking place now, how do we actually ensure that people retain the knowledge to continue with the processes and to understand where the business is going with this? I will mention it's a people thing again. So the challenges. Healthcare, I mentioned earlier, is the top targeted industry right now. We've looked at oil and gas, while that is very much the case as well. Finance has actually been the leader on mapping across how to deal with cybersecurity in healthcare. Innovation goes hand in hand. It creates new vulnerabilities. There's no choice that innovation has to play a part as well in actually driving healthcare to whatever the new norm is. the people continue to be a challenge. There's a great saying from a lady called Connie Podesta: life would be easier if it weren't for other people. That certainly will be the case with COVID-19 in terms of actually bringing it across the global and making it a global pandemic. But it is also the case very much so about actually not just flattening the curves, but actually getting rid of the curve with COVID-19. And this is a problem where people don't have the trust and be able to actually use that to create a better culture within organizations. We also as well have the aspect of processes. With these changes now, how are you actually helping to create the processes and communicate them across the board? And who is driving that? So I've looked up on many different sites as well, which are within the healthcare world, but not just, whether it's HT ISAC or whether it is actually Health ISAC or the other organizations. A lot of the processes are not updated, and that is a challenge as well. We know that there's a huge deficit in resources for cybersecurity as well, very much so in Ireland and across the board. We know that in Austin, the McCombs Business School did actually run a fantastic program for cybersecurity. Also, as well, I'm connected with a great lady in HP Enterprise who is running a fantastic program for Girl Scouts within cybersecurity. So it's not just about ensuring that they are educated as young teenagers for protecting themselves, but it's helping them to gain an interest. It's creating diversity beyond what could be deemed as a predominantly male industry, but we know that that's not now, of course, with women in cybersecurity and other organizations. But how do we actually build up the resources? I saw a program on TV actually the other week about how Korea actually is part of the children's schooling, that cybersecurity is on their agenda from a very young age, and about enriching them. So I'll leave you to think any further on that. Operational technology is about automating the processes as well. Legacy systems are causing a great problem, particularly in healthcare. I'll go back to as well where we had the paper-based, where you are actually running the big storage suites technology. Now it's all about automation. I've done research with Gartner to understand as well what their key points are and what their findings are. And I'm sure a lot of people on the call actually know that this is a lot more what the way forward is. Risk management, we certainly know that this is very much, how do we consolidate this actually into being at the heart of what the change is about? How are you having visibility working in the cybersecurity world of actually what the key risks are? I spoke to a leader in, I think it was in Disney World actually, at RSA back in February. And he is great at doing his dashboards regularly and feeding them up to the board. And I asked what was their feedback down. And he gave me a very wry smile that sometimes it's very difficult to get feedback down actually. And this is a problem that CISOs are very much focused on now. And I will actually just go back as well, that where this can be a challenge in its own right, the resources to have CISOs in place with healthcare experience is a big problem. Certainly within the finance and within other industries or within innovation, it is okay. Ireland and England are actually desperate and do not actually have a CISO, I suppose, tribe, and therefore roles are being filled with risk management experience, but not necessarily with the business acumen and the technology that's needed. So what can you do about it? I'm going back to the humanizing aspect again. So we ask you as individuals to be more curious, whatever your role is. Talk more to your people, share your ideas. Even in the people that I spoke to with OWASP, so many of you had fantastic ideas. I love to hear what you had to say, technical or non-technical. Is it a case that you actually set up a morning breakfast? Of course, the ideal thing would be face-to-face, but in these times, can you set up one? Can you encourage and communicate more with your line management on how actually to be more innovative and creative yourselves within your work environment? Just getting my slides here. When I say find your tribe, what I mean by that is, no matter where you go, there are like-minded people in an organization, whether it is that you have something in common or whether it is that you have an idea. Clearly, I am somebody who likes talking. I'm very curious to hear other people, what they have to say. Is it a case that you can set up perhaps maybe a little innovation hub, or just like a meetup within your organization as well? And that is where then, by actually becoming an expert reference group within, certainly within healthcare, that is really, really important. And when leading on change, that is something that is greatly encouraged. It's a steering group, and communicate. People really misunderstand how and what effective communication is about. Is the message communicated clearly? Perhaps in the person who is communicating that message, but does it mean actually that the person who is receiving the message is clearly communicating? And here again, we're looking at actually the different components of effective change with leadership. You can have great leaders, they can be humble, they can be motivating, but not necessarily great communicators. It's the behaviors that we look at all together that now make humanizing change the necessary aspect to achieve the identified outcomes. So in summary, where the abstract was about digital transformation and the challenges that bring it, the question is, how do you strengthen your digital workplace to sustain that digital transformation? Here's a quote that came from a professor in the UK on why change management plays a critical or central role. She's very much involved in the cybersecurity world and has set up a major program at Imperial College in London, to which I am connected, and now is a digital advisor to the UK government in cybersecurity. Just as a little nugget of information, the National Health Service, who is the public healthcare entity, has handed powers over to GCHQ, i.e. a federal organization. That is the equivalent of CISA. And that will bring with it more change as well, from not just who's managing patient care, but our patient data, but also as well, it demonstrates that now cybersecurity is going to have a more important role on the board's agenda. It is having a more important role in everyday conversations, which is necessary. I wrote a blog last week, actually, focusing on the Irish leadership and asking and encouraging that cybersecurity in healthcare plays a bigger role cohesively with healthcare, with government, and on the line staff as well. Change management, or managing this change, working with the behaviors on how to encourage people to be part of this moving forward, is fundamental. But I leave you with the question as well. Managing change was not necessary to invoke telehealth in COVID-19. It was not necessary to nurture it as part of working from home. These particular items happened mandatory for us to continue to work and support our organizations. and to be actively involved as well in being employed. It has created great questions on actually where now and how does managing change actually change itself on moving forward. And with that, I leave you with for any questions.
Thank you, Hazel. If anybody has any questions, feel free to unmute yourself and ask. I didn't see any in the chat right now, but we are open. We got a few more minutes left here before the top of the hour.
Yeah, I mean, I can add it's a very broad and comprehensive conversation, and it's been very interesting for me to look back and see that where sometimes there has been resistance to change and adoption of new technology, of creating new processes. COVID-19, there was no option. You know, I sound like Apollo 13 now, but there wasn't an option. People adapted. And now it's about actually how is the risk going to be managed and the business continuity moving forward. So the role of change has actually morphed also.
I have a quick question, Hazel. You mentioned that Korea was pushing cybersecurity down into the schooling level of that. Have you heard anything about change management and cyber and just security in general pushing towards the med school level in the US side or any of that area? Or are they very focused on just the healthcare? I don't know if say healthcare, but the medicine side of it. Have you heard of anything there?
So just so that I'm clear on your question, is change management, if you don't
Even
mind.
change management, you mentioned earlier the cybersecurity. I mean, change management is obviously organizational wise is a huge shift of stuff, a potential shift of things. But also some of the change management and just the awareness level of stuff is really one of your first steps in change management. Has there been any cybersecurity awareness push to say a med school-ish level type of awareness thing, or is it outside? Because a lot of times doctors know HIPAA, they understand HIPAA when they come out of schools and things like this, but they don't understand the technologies or the possible ramifications of some of these things. Is there anything of that going into a med school level? Because like you mentioned earlier, CISOs are lacking at the healthcare side. I think the CISOs are lacking from the, like you said, business side. They're not coming from the ground up doctor side. They're going into a CISO type position or something of that nature, administrivia. I'm just wondering have you heard anything along those lines in the med school level?
Yes, I have. So certainly Health 2047, as I say, with the American Medical Association, are absolutely pushing this topic through and through, and there is great interest at that level. Across the board as well, you have the American Hospital Association and looking at what that is doing. So education and awareness, ironically, are actually two of the top challenges now within what I would call the gamut of change. And I have spoken to many health organizations in the last few months, and it's not just about education, because there are lots of educational companies out there and pushing for HIPAA and NIST and ensuring, I suppose, ticking the boxes for the different frameworks. But then it's about actually how is that education and awareness measured, which is why that we have UEBA, user experienced analytics, behavioral analytics. And that's where actually where there can be different entities, it's how do you consolidate all of those together? And that's what actually a lot of the organizations are looking for. How do you approach it rather than as separate prongs? And certainly there isn't an option now, because the costs on the hospital level are just phenomenal, and the costs as well have for breaches and threats and ransomwares, etc. And it's causing reputational damage on top of everything else. So therefore, there is a need to drive awareness and cyber and education on that. And there are lots of clinical champions at national, federal, across the country level. And now my intention, certainly in Texas, is actually to really drive that forward.
Thanks, stuff. Anybody else have any other questions?
Yes, I do have a question. This is Hussein Tanwari. Thank you, Hazel, for your interesting talk. I think when we talk about change management, we used to assume that it's rather incremental change. Whereas these days we are going through a very radical type of change. I don't know if even if radical, the term radical is enough to describe, because so many dimensions of organizations, processes, technologies are changing simultaneously. So is there any focus on this type of change, which may be a major discontinuity? Even in the context of business continuity, I think we focused on certain types of risks and how the business can continue. But when there is declaration of emergency across the board, across everything, not just healthcare, all industries, entire society. Again, should we change the way we think about these issues going forward if we hit another major discontinuity like this?
Yes, it's a very topical issue. Right now, so I'm part of different change groups, and ironically, actually, I'm bringing about where this transition is now and what does it look like, as opposed to what you mentioned as the historical approach. Where businesses are now reviewing and re-strategizing, etc., there is a need to revise processes and bed down the here and now. There is a need then to revise those further down the line. And where there are great struggles, from what I have learned and what I am told, is who is actually driving all of that. It's not the CFO, it's not the CIO, it's not the CEO. Leadership aren't able to do it on their own. And equally, the frontline staff is important to think of those further down the line. So this comes back to communication. How effective is that? And looking at what the new risks that have been identified. So there is certainly, it has been agreed, identified, and understood that in the near future, how and who is going to help and support that beyond the normal roles or beyond the current roles within organizations. And it's causing concern.
Thank you.
Anybody else? If not, we are at the top of the hour. I'd like to say thank you very much, Hazel, for doing this. This has been a great discussion on organizational change management in healthcare. Really enjoyed it.
Yep. Thank you so much, Hazel. Really appreciate it. This is Kate.
Thank you.
And I would say I would see everybody at the happy hour in a few weeks, but unfortunately not. We will have the next meeting at the end of June, the last Tuesday of the month of June. I'll post that information soon enough. But thank you all for coming and have a good day.
Thank you.